social justice presentation. Hello, everyone. My name is Stephen Eko, a psychologist. And today we will explore the crucial topic of social justice in behavioral health. As high school students, you play a pivotal role in shaping our future society, where equality or equity and fairness are fundamental. This presentation explores how behavioral health agencies, both locally and nationally, advocate for social justice. It will examine specific actions taken by these agencies to address disparities in mental health care and promote equality for all individuals. Upon understanding these efforts, we can better appreciate the importance of advocacy and awareness in achieving equitable mental health outcomes. Together, let us explore how we can contribute to a more just and inclusive mental health system. Oppression is the systematic and pervasive mistreatment of certain groups within society, often based on characteristics such as race, gender, ethnicity, religion, or sexual orientation. This mistreatment manifests through the denial of fundamental rights and opportunities, economic exploitation, and social exclusion. For instance, historically, slavery in the United States and apartheid in South Africa are prime examples of several oppressions where entire groups were denied basic human rights. In contemporary times, oppression continues in various forms, such as racism, where individuals are discriminated against based on their race, and gender discrimination, where people face unequal treatment due to their gender. Shamma-Blesh, et al., 2022. Such oppression practices create significant social and economic disparities, reinforcing a cycle of disadvantage and exclusion for the affected groups. Understanding the nature and examples of oppression is crucial for developing strategies to combat and prevent these injustices in modern society. Shamma-Blesh, et al., 2022. Discrimination. Systematic mistreatment of certain groups involves persistent and organized discrimination against specific populations based on characteristics such as race, religion, gender, economic status, sexual orientation, or disability. Racial and ethnic discrimination remains widespread, with minorities often facing biases of biased law enforcement practices and limited access to education and employment. Excuse me. Religious minorities may suffer unequal treatment, such as seen in countries where certain religions are marginalized. Gender inequality is evident in workplaces, where women often earn less than men for the same roles and face glass ceilings in career advancements, Miller et al., 2021. Economic exploitation targets marginalized communities, forcing them into low-paying jobs with poor conditions. LGBTQ plus individuals frequently experience social exclusion and denial of basic rights, such as marriage equality and protection from hate crimes. Similarly, disabled people face numerous barriers, from inadequate accessibility in public spaces to discrimination in employment opportunities. These systemic practices not only harm the targeted individuals, but also perpetuate inequality and higher social progress. Addressing these issues requires concerted efforts to ensure equal treatment and opportunities for all. Privilege. Privilege refers to unearned advantages. Certain groups receive privilege refers to unearned advantages certain groups receive based on characteristics such as race, gender, socioeconomic status, sexual orientation, physical ability, and age. White privilege is evident in rare areas like housing and education, where white individuals often have easier access to better schools and safer neighborhoods. Male privilege is seen in the workplace, where men typically experience faster career advancement and higher pay compared to women. Socioeconomic privilege allows those with higher incomes to access quality health care, which can lead to a better health outcomes and longer lifespans. Heterosexual privilege includes social acceptance and legal rights that LGBTQ plus individuals may lack, such as the ability to marry without facing discrimination. Able-bodied privilege is apparent in the accessibility of public transportation, which is often designed without considering the needs of disabled individuals. Age privilege manifests in social attitudes, where older individuals are frequently given more respect and decision-making power. Recognizing these privileges is crucial for understanding the disparities that exist in society and working towards a more equitable future for all. Johnson, 2023. Social justice. Social justice involves creating a fair and equal society where all individuals have the same rights and opportunities, regardless of their background. Ensuring equal rights for all racial groups is a fundamental aspect of social justice aimed at eliminating social discrimination and promoting diversity. Gender equality focuses on providing equal opportunities for men and women in education and professional careers, ensuring that everyone can achieve their potential. Social justice also demands fair wages and safe working conditions for all workers, which helps reduce economic disparities and improve living standards. FIN 2020. Universal access to quality healthcare is another crucial component, ensuring that every person, regardless of their financial situation, can receive necessary medical care. LGBTQ plus rights, including marriage equality, and essential for ensuring that individuals of all sexual orientations are treated with dignity and respect. Additionally, disability rights advocates for accessible public access spaces and services, allowing disabled individuals to participate fully in society. These examples highlight the broad scope of social justice and the importance of implementing policies that support equality and fairness for all members of society. FIN 2020. Role of psychiatrists in addressing social justice issues. Psychiatrists play a crucial role in addressing social justice issues within the behavioral health field. They diagnose and treat mental disorders that may stem from social injustice, such as trauma or discrimination. Psychiatrists advocate for equality, equitable access to mental health services, ensuring that marginalized communities receive the support they need. They provide medication management and therapy, helping clients manage symptoms exhibited by social inequalities. Through research, psychiatrists contribute to understanding mental health disparities among different social groups, in informing policies that promote fairness and accessibility. Collaborating with community organizations, psychiatrists participate in initiatives aimed at addressing systemic barriers to mental health care. They also educate clients on their rights and empower them to advocate for themselves in navigating and the complexities of the mental health system. By fulfilling these roles, psychiatrists contribute to creating a more just and inclusive society where everyone has equal opportunities to mental health care. Johnson, 2022. Role of psychologists in addressing social justice issues. Psychologists are integral in addressing social justice issues within the behavioral health field through various roles and interventions. They conduct psychological assessments and evaluations to understand how social injustices impact mental health. Psychologists provide therapeutic interventions, particularly for trauma resulting from discrimination or systemic oppression. They advocate for culturally competent practices in mental health care, ensuring that treatments respect and address clients' cultural backgrounds. Through research, psychologists explore the psychological impact of discrimination and inequality, influencing policies and interventions to promote social equity. Shana Blesh, et al., 2022. Counseling provided by psychologists often focuses on supporting marginalized populations, helping them navigate and heal from the effects of social injustice. Additionally, psychologists play a vital role in training mental health professionals on diversity issues, fostering inclusive practices within the field. By fulfilling these roles, psychologists contribute to advancing social justice and improving mental health outcomes for all individuals in their communities. Shana Blesh, et al., 2022. Role of social workers in advancing social justice issues. Social workers are essential in addressing social justice issues within the behavioral health field through advocacy, supports, and systemic change. They advocate for clients' rights and welfare, ensuring they have access to necessary resources and services. Social workers provide counseling and support services, addressing these psychological and emotional impact of social injustices. They confront systemic barriers to services, advocating for policies and practices that promote equality and inclusivity. Shablesh et al., 2022. Engaging in community organizing and activism, social workers mobilize communities to address root causes of mental health disparities and advocate for social change. Through case management, social workers ensure holistic client care, addressing not only mental health needs, but also social determinants of health. They actively promote policy changes that dismantle discriminatory practices and promote social equity in mental health care. By fulfilling these roles, social workers play a crucial role in creating a more just and compassionate society where all individuals can thrive. Shana Blesh, et al., 2022. Mental health nurses in addressing social justice issues. Mental health nurses contribute significantly to addressing social justice issues within the behavioral health field through their role in advocacy, education, and patient care. They provide direct patient care and advocacy, ensuring that clients receive compassionate and competent mental health services. Mental health nurses educate clients on mental health issues, empowering them to understand and manage their conditions effectively. Collaborating with interdisciplinary teams, they contribute diverse perspectives to comprehensive care plans that address clients' social and psychological needs. Mental health nurses address healthcare disparities in communities by providing accessible and culturally sensitive care. They promote wellness through preventive care, initiatives that aim to reduce the incidence of mental health crisis. During crisis situations, mental health nurses offer social support and intervention, stabilizing clients and connecting them to necessary resources. Through these efforts, mental health nurses play a vital role in promoting social justice and equity in mental health care, advocating for the rights and well-being of all individuals in their communities. Smith, 2023. Local behavioral health agencies in Texas advocating for social justice. Local behavioral health agencies in Texas have actively engaged in social justice advocacy through various initiatives and actions. For example, the Harris Center for Mental Health in Houston has implemented programs aimed at reducing disparities in mental health care access among underserved communities, advocating for equitable treatment and resources. Integral Care in Austin has focused on addressing homelessness among individuals with mental illness, advocating for supportive housing solutions and community integration. Dallas Behavioral Health Care Hospital has collaborated with local law enforcement to provide crisis intervention training, promoting compassionate responses to mental health crises within the criminal justice system. Goldbain Center in Victoria has campaigned for increased funding for mental health services in rural areas, advocating for policy changes to improve access to care. StarCare Specialty Health System in Lubbock has developed outreach programs targeting stigma reduction and mental health education in schools and workplaces. MHMR, Tarrant in Fort Worth, has actively participated in legislative advocacy efforts, lobbying for policies that protect the rights and improve the quality of life for individuals with mental health challenges. Through these actions, local behavioral health agencies in Texas play a crucial role in advancing social justice and promoting mental health equity in their communities. Johnson, 2023. National behavioral health agencies engaging in social justice advocacy. National healthcare behavioral health agencies have been instrumental in advocating for social injustice or social justice within the field, influencing policies and promoting awareness across the United States. The National Alliance of Mental Illness, NAMI, has actively campaigned for mental health parity legislation, ensuring that mental health services receive equitable insurance coverage comparable to physical health services. DeLuca et al. 2021. Substance Abuse and Mental Health Services Administration, SAMHSA, has implemented initiatives to reduce disparities in mental health care access among minorities and underserved populations, focusing on culturally competent treatment approaches. The American Psychological Association, APA, has published research and policy statements advocating for the integration of social justice principles into mental health practice, emphasizing the importance of addressing systemic factors that contribute to mental health disparities. Mental Health America, MHA, has developed advocacy campaigns to raise awareness about the intersection of mental health and social justice issues, promoting inclusive policies and practices. The National Council for Behavioral Health has lobbied for increased federal funding for mental health services and comprehensive health care reform that prioritizes mental health equality. The Treatment Advocacy Center, TAP, has focused on promoting laws that promote or protect the rights of individuals with mental illness and ensure access to timely and appropriate treatment. DeLuca et al. 2021. Through these efforts, national behavioral health agencies play a crucial role in shaping a more just and equitable mental health system in the United States. Conclusion. In this presentation, we have explored various initiatives and actions taken by behavioral health agencies to advocate for social justice, from local efforts in Texas to national campaigns across the United States. These agencies have demonstrated a commitment to equity in mental health care. It is clear that advocacy and awareness play crucial roles in addressing disparities and promoting fairness for all individuals. As high school students, you have the power to influence the future of mental health by staying informed and actively participating in initiatives that support social justice. I encourage each of you to continue learning about these issues and to take action in your communities to support mental health equity. Together, we can create positive changes and ensure that everyone has access to the mental health resources they need. Thank you for your attention and commitment to advancing social justice in behavioral health. There are some references here to support this presentation. Thank you.